Hey everyone, my name is Justin Nabrowski and I'm a fourth year pharmacy student from the West Virginia University School of Pharmacy. And today we're going to take a look at how pharmacists can alter the same medication to have different effects. Today we're going to look at the difference between chewable aspirin and enteric-coated aspirin. Let's get started. Here we've got 2 flasks of warm water. We'll add a chewable aspirin into one flask and the enteric-coated aspirin into the other. Pay close attention to the 2 different flasks. What do you notice? Look at that. The chewable aspirin disappears faster than the enteric-coated aspirin. That's because the enteric coating is protecting the medication so that the stomach cannot damage it whenever a patient takes the medication. However, it will not act as fast as the chewable aspirin. The chewable aspirin is also designed for patients that struggle to swallow pills, as they can easily chew it and then take that medication that way. When a medicine dissolves faster, it can be absorbed faster and can start to work faster on your body. However, sometimes pharmacists have to protect a medication to make sure we can get the full benefit from it, as you can see with the enteric-coated. Pharmacists also alter medications to prevent certain side effects from affecting the patient, such as irritating the stomach with the enteric-coated aspirin. Now I'll have Dr. Galvez explain how pharmacists can alter medications to benefit our patients.
Why do pharmacists care about this? Well, sometimes we are going to have patients or kids that they are not able to swallow a tablet. Again, it's the same drug. It's going to be, in this case, it's both the same one, it's aspirin. But what we do is modify with an excipient that is able to swell when we have water. So, for example, our saliva. When this excipient, that is a cellulose, swells, it's able to release the medication, and that is how you saw that it was very quickly being dissolved in the water. Sometimes we have medications that you hear from Justine that could hurt the stomach. We want to protect the stomach from that irritation induced by the medication, or we want the medication to actually act in that area. So that's when we are using those enteric coating. So again, it's the same medication, but it's being added a coating, a film that can resist the pH of the stomach and actually be released later on when it reaches to the intestine. So again, all these concepts that you are learning in class, in school, about chemistry, about solubility, about pH, is going to be helping to really make decisions of which drug will be the best to give to the patient and which dosage form can we be given or modify to adapt to the needs of every patient. Thank you.